conception, the genetic instruction from both parents form all the human characteristics. And yet, all of us have our own unique features that make us all different from each other. Nature has its own way of modifying the traits that we inherit from our parents. These changes or modifications in genes are known as genetic mutations and are at many times responsible for the genetic traits that we inherit and also the diseases that we suffer from. Examples of these diseases include Huntington's disease, hemophilia, cystic fibrosis, breast cancer, etc. With advancement in medical science, it is now possible to detect abnormalities in genes or mutations by genetic testing. Genetic testing is a kind of medical testing that identifies changes in normal chromosomes, proteins, or genes. The results of these tests can confirm or rule out a suspected genetic condition that an individual is predisposed to. These tests can also predict the chances of developing a certain disease or passing it on to the next generation. Currently, there are more than 1,000 different types of tests that are used for this purpose of genetic testing, also known as predictive testing. Predictive genetic testing has opened a lot of treatment and disease prevention options, which has totally revolutionized the way healthcare functions today throughout the world. Although this has a major advancement in the medical field, it is also a cause for controversy because of the emotional turmoil that the patients have to face after taking a predictive genetic test. Even before getting tested, knowing the social and psychological implications of the test results can alter the decision to take the test for a person who has a history of certain genetic disease. If this person who is being tested has children, then he or she also faces the truth that they might pass the disease to their children. Another main concern is that do parents have the right to get their children tested for a genetic disease predisposition? All these issues about human genetic testing make it an ethical issue, questioning whether or not to opt for it. So why do we do genetic testing? The answer for this question lies in the various kinds of tests that are available to us. Carrier testing is mostly performed when there is a history of certain genetic disease in the family like breast cancer or the Fragile X syndrome. This information is, however, imprecise because the test only gives us a possibility that the trait can be passed on to the children of the carrier. Pre-implantation genetic testing is a method in which embryos with genetic defects or even eggs with mutated genes are excluded for implantation. Prenatal diagnostic testing is the test carried out on a developing fetus. When there is a risk of having a certain kind of disorder, newborn screening is done when parents want to screen the new baby for any genetic test or if their healthcare provider has instructed them to do so. Pre-symptomatic testing is for predicting adult onset disorders, and the test is performed on a person who has symptoms for a certain disorder currently. But there's also if there is a person in their family who is affected by a certain genetic disease. If this person is tested, has a defective gene, then he or she is surely going to get this disease sometime in their lifespan. Pre-symptomatic tests for estimating the risk of adult onset cancers are done on individuals with family history of such diseases. Due to the nature of these diseases, the responsibility of the healthcare provider does not end with conveying the results to the patient. It is important to provide appropriate care and resource to the patient so they can deal with the implications of the test. The results of the genetic test can be life-altering and hence must be delivered in an appropriate way. It is important to understand why the patient is seeking this information and how much knowledge do they have about this topic. Such information could not be disclosed over the phone or in a letter. This kind of approach is known as genetic counseling. A private and a comfortable setting should be avoided to the patients while providing this information. In the interview on npr.org, Paul talks with Lauren Dublin, who went to a genetic counselor before getting tested because several of her relatives were affected by breast cancer. On her interview, she says that, "I thought no matter what it was, positive or negative, I could handle it. It was positive, and I felt dizzy." Even though Lauren was prepared for the worst, the information was overwhelming for her. If such situations are not handled carefully, they can be very devastating. which is why some people try to stay away from retrieving this information. Another problem with these kind of tests is that the information in this test is vulnerable to misuse against the tested individuals by providing it to the insurance companies, employers, and subjecting them to discrimination. In the article, Ethical Aspects of Human Genetic Testing, an informational paper states that genetic tests are conducted on small samples of tissues that together with the results of the test can be theoretically stored indefinitely. This has resulted in the need to consider as to how long residual test samples can be kept and the information generated by them can be stored. Although genetic testing holds a very promising future for the coming generation, we have to understand the responsibility it puts on our shoulders. Ethics of genetic testing, the author has said that testing without viable treatment opens a Pandora's box of problems such as anxiety and depression. A lot is still unknown to us about genetic testing and how it works. Many of us rely on our fate to take us where we want to be in our lives. What if we get the power to decide our own fate? If we do not use this power wisely, we will end up with a generation that has tremendous conflict and lust for perfection. We need to prevent our children from undergoing any such test, unless it is absolutely essential for them. People who are considering taking a genetic test should visit a genetic counselor first and understand the implications of the test on their lives. Although genetic testing provides a lot of information, it also holds you responsible for the next generation's future. In the race for perfection, we might lose our uniqueness and characteristics that make us all different. Therefore, it is important to consider all the aspects of genetic testing before making any decisions. Thank you.